This is Boomer Life on CL 650.
I'm tired of waking up tired. Waking up tired. Yeah, waking up tired. I'm tired of waking
Aren't we
up
all,
tired.
huh? But there's the flip side to I'm tired of waking up tired is there's nothing better than getting up after a great night's sleep, right?
Absolutely.
You just jump out of bed and you're like, oh, that was fantastic. Epic night's sleep. And that's what we're hoping to get you here today. We have Farouk Manji from SleepShop, your sleep experts. The fifth location just about to open on the North Shore. You've been telling me about it a little on the QT here for the last few months, but it's any day now, right?
Absolutely. 1177 Marine Drive in North Vancouver. So we're excited as...
What's the cross street? Is it near Cap Mall or where is it near? Do you know?
It is, I don't know the cross street, but all I know is there's a McDonald's on the corner
I know that,
of that street and Marine Drive. And
Everybody
we're right
on
there.
Everybody North Shore knows exactly where it is now that you said McDonald's. Okay, so when people come in and they're looking for a mattress at SleepShop, where are the areas in the body that people complain most about? Neck, hips, back, what is it?
So shoulders, lower back, and then neck.
Right.
Those are kind of in that order.
I get that checklist,
So that's where it's important that we, and I'm sure we'll talk about it, but the comfort testing is important.
Yeah.
Getting the right pillow is important.
Yeah.
And it's more than just the mattress.
The pillow for me is really important. You call it what? The bed?
The bed for your head.
And it really is very important because that alignment of your neck and your shoulders really affects the rest of your body.
It does.
Now, the reason why I'm bringing up alignment is because we're going to have Dr. Rosina Budwani on in just a moment. We are kind of looking back at 2016 and some of the special guests we had on. Do you go to a chiropractor? Do you go to Dr. Budwani?
No, I don't. I mean, haven't had to get any alignment.
Oh, you're lucky.
And,
I go regularly to a chiropractor. I couldn't make it through. I'd be, a totally different person if I didn't go. So I know the importance of having proper alignment, which spills into what kind of bed you have as well. So earlier in the year, we had an interview with chiropractor Dr. Rosina Budwani, based in Burnaby, about alignment and getting a good night's sleep.
One of the questions I ask my patients is, how do you sleep? I actually get them to lay on the chiropractic table and show me their sleeping position. I would say probably one of the most common sleeping positions is stomach sleeping. And that's probably the worst thing you can do to your spine. And the reason why is because when you're on your stomach, you're actually putting a lot of compression on the lower part of your back. And usually when you're on your stomach, one leg is bent and one leg is straight. So then you're torquing your pelvis out of alignment. The third thing that happens is your head is rotated to one side. And usually people have a favorite side. So it's rotated to one side more than the other. So that, again, twists the cervical spine and the muscles of the neck. And that's what causes a lot of neck, shoulder, and lower back problems.
I'm sure there's somebody listening right now who says, bingo, that's me. So you're saying the majority of people sleep on their stomach? I can't do it because it hurts my back. I assume I'm there for a minute and I'm like, oh, I'm out. I'm on my side again.
Yeah. I would say it's a tie between those that sleep on their stomach and those that sleep on their side. But when they say they sleep on their side, that usually means that they're half on their side and half twisted onto their stomach.
So one leg is straight and one leg is bent, right?
Yeah.
Mm-hmm.
Yeah.
I do that a bit too.
Yeah. So
now, is there a preferred sleeping position?
The laying on the back is probably one of the best ways you can relax your spine and relax your muscles, but side sleeping is fine as well. The trick is to try and have the right side of the body matching the left side of the body so that your spine is in alignment. Your muscles are balanced on both sides of your body. When you have your arm or your leg doing something different on one side rather than the other, that's what causes the twisting and torquing of the spine and the muscles, and that's when problems start. Side
sleepers, I'm guessing, also maybe have one arm under the pillow.
Yes.
And does that affect things?
Yeah, so having one arm under the pillow, it's almost an innate response by your body to tell you that maybe you need a higher pillow. And one of the most common things that happens is that the arm falls asleep because you're basically stopping the circulation going down the arm. Plus, the stress on the cervical spine causes the nerves to be irritated, and that's what can cause that numbing, tingling feeling in your fingers when you wake up in the morning.
Mm-hmm. Well, we've all had the arm that's so asleep, it's like, what is that? Yeah, and then when it gets blood in again, it's an odd sensation. So a lot of people, I'm guessing, as you said, stomach sleepers, side sleepers. One thing I do that my chiropractor, he's the one who told me to do this, is to put a pillow between my knees to keep my... What is that doing?
So when you have a pillow between your knees, the distance between your knees matches the distance between your hips. So it actually relaxes the muscles of your pelvis and your legs. But more importantly, it allows the nerves that exit your spine and go down your legs to be parallel. And when they're parallel, they're more relaxed. And they almost rehabilitate from the day before. When people have a pillow between their knees, I also tell them to make sure that their knees are evenly bent. So some actually have a pillow between their knees, but then the top leg is more bent than the bottom leg, which is fine. It's better than not having a pillow at all. But the best position is to have the pillow between your knees and your legs evenly bent.
And does it matter really what it is? What kind of pillow? Just something that's keeping your knees apart, right?
Yeah. And it's better if it is, at least 4 to 6 inches apart, just so that the knee distance apart matches the hip distance.
All right. Now, Farouk, I've seen some pillows that are like side sleeper pillows. They're long. Do you have those?
Yeah.
You've seen them, or you have them? Well, what is that?
So just about all the pillows that we're just talking about. So we've got a range of pillows that are designed for the way you sleep. So, I mean, if you just can't help but sleep on your stomach, and no matter what you've done to train yourself, even though it's not a good thing, and I know Rosina's probably going to say, hey.
But these are habits that are hard to break, right?
They are. But you know what? I've even told my 60-year-old and 7-year-old patients that it's not too late to start. Mm-hmm. You just have to, persevere, and even 15 minutes before you go to bed at night, just try it for 15, 20 minutes, and eventually your body will understand what you're trying to do, and eventually it will conform.
Okay, so what pillows do you have to support someone who was a stomach sleeper or a side sleeper?
So it all really depends on 2 factors. One is the height of the pillow, and the other is the firmness of the pillow. So the different types of pillows, whether you get a memory foam pillow or a latex pillow, some people prefer the filled type of pillows, which could have down feathers, they could have wool, whatever the assortment is of a filled pillow. You just want to make sure that you've got the right pillow height and the right firmness to keep your head aligned with your spine. We've also got an assortment of knee pillows where you can, place between your pillows, between your knees, or even a body pillow, which kind of gives you the full length, where you can put between your knees and kind of snuggle and hug.
You have the boyfriend one. I've seen those with the arm. Have you seen those ones?
Or with pregnancy. It's great. Those body pillows are great for my pregnant patients as well. So pregnancy and kids. I get my pregnant patients and my kids to sleep like that too, with a pillow between their knees. It's better to start early.
And I'm not sure there's many women who are stomach sleepers when they're pregnant.
No, but they will stagger their legs. So they'll be on their side, and then one leg will be higher than the other. So the pelvis, again, twists out of alignment.
Yeah. So that's the main thing, is whatever you're doing, what's the word? A mirror one side to the other, right? So whatever your left side's doing, have your right side doing.
Exactly.
Symmetrical. That's the word I'm looking for. Be symmetrical when you're sleeping.
We're talking about pelvic tilt. Is that right?
It's actually pelvic rotation.
Okay.
So pelvic tilt is more when you forward and back. So the tailbone goes under or the tailbone goes out. Whereas a pelvic rotation is when one side of your hip is rotated backwards and one side of your hip is rotated forward.
Okay. That's the voice of Dr. Rosina Badwani, Doctor of Chiropractic, and our regular sleep expert is Farouk Manji from SleepShop, your sleep experts. So I want to go back to the neck because a lot of people have shoulder and neck and pain. A lot of times it's because of the way they sit at their desk. They've got a lot of tension in their shoulders. So what are you trying to achieve with the mattress and the pillow, with the alignment of your head and your neck? Because I have experienced this where you feel like there's like a tight spot in your neck and you're almost constricting blood flow and things, because everything's going through your neck for your whole body, right?
Yeah, I think the most important thing to remember is that your ear and your shoulder should line up with one another. So whether you're sleeping on your back or you're sleeping on your side, just have someone take a look at you or have someone take a picture of you. And just make sure that the ear and the shoulder are one on top of the other. When they are one on top of the other, that just means that the alignment of the neck matches the alignment of the spine, the rest of the spine. It's when the pillows are too high and the head is held up too high that can even close off the airway passage, which is one form of sleep apnea as well. But sleeping with a pillow that's too high can cause compression on the cervical spine as well. Sleeping on your side with a pillow too high can compress one side of your neck. So all of these things, again, can cause neck problems, headaches, numbness and tingling down the arm, all sorts of neck problems.
With your shoulder, sometimes you sleep with one shoulder up or one rolled underneath, right? So how do you get it? Men with broader shoulders, you would typically roll one shoulder. So is that where the bed comes in, that it's got just the right amount of softness to absorb your shoulder? Is that what you would suggest?
Yeah, absolutely. And it really helps with... when we talked about the relaxation that your body needs to go through to get into the REM sleep and into the different stages, this is one factor that helps with that.
Okay. And usually we want to, if somebody has really broad shoulders, more than likely they need to have a pillow that is quite high. And when I say high, not like really high in the middle, but needs to be thick enough so that they don't have to, pull down their shoulder or twist their shoulder.
Roll their shoulder underneath, right?
Exactly.
Yeah. Now, I saw a pillow one time, Farouk, that had kind of like, it was a regular pillow, but in the middle it was cut away a little bit. What's that?
That's just allowing your head to sink in to create the support for the base of your neck.
So do you think that's a good way to go, to have the sort of like it's got a bit of a wave at one end that coddles the back of your neck?
Yeah, so when you look at a pillow, and I hope Farouk agrees with me on this point, but when you look at a pillow, the outside of the pillow, the perimeter of the pillow is more important than the actual middle of the pillow. So you want the most support, not for the head, but more so for the neck. Because when you look at a neck, let's say you were to take look at a picture of somebody's neck, an X-ray of a side view of a neck. Usually the curvature of a neck should be approximately 35 degrees. When you sleep at night, you want that 35 degrees of a curvature. So you can't, flat pillows are just not good for you. They almost decrease the curvature of the neck to 0 degrees, which again compresses the discs and the nerves of the spine. So I always tell people, when you're looking for pillows, look at the perimeter of the pillow, because that's where it supports your neck.
I have, what's the brand name of pillow I have? Tempur-Pedic. And I like that. I've had it for I've had it for too long. We've discussed this on a previous show. Time to get a new one. But I'm going to go back and get a new one because I just think it's fantastic. It just gives you that memory foam is really good, right? Because that allows your head to sink in, but then your neck to be supported. That's what I find with it. Is that what you kind of recommend?
Yeah, the memory foam is really great. We actually, at our clinic, we have water pillows. Yeah. And I don't know if you've heard of water pillows.
Yeah, we talked about that. I stayed at a hotel. It was this 5-diamond hotel, and they had a menu for your pillow. You could have all different kinds, and one was a water pillow.
Yeah, it's great to see hotels giving you that option these days. But with the water pillow, because
usually they have the crappy pillow or the even crappier pillow. That's usually what you get in a hotel.
Usually the mattress is fantastic, and the
pillows are terrible. Yeah, I agree with you.
So the water pillow, that's actually what I sleep on. And the way that the water pillow works is it's got a bladder on one side of the pillow, and you fill it up with water. And what's great about it is that you can customize the height and the feeling of the pillow. So I usually start people off with 2 to 3 liters of water, but you can go up to 6 liters of water. And the great thing with water is it doesn't decompress with time.
It's free.
So yeah, exactly. It's free. So that's one of my favorite
Now,
pillows.
What are your thoughts on water beds? Just kidding.
Yeah.
Our thanks to Dr. Rosina Budwani, based in Burnaby. And you're telling me that her sister is part of her practice there in Burnaby, right?
Yeah, it's a joint practice, and she does naturopathic medicine.
All right. So you get the 1-2 punch.
That's right.
We have to have her on the show one day.
One day we will bring her on.
All right. Good to know. When we come back, we're going to get into the comfort testing that you do, right? And how you decided, and your dad and grandfather decided early on, that you wanted to be a specialty store at SleepShop. So we'll pick that conversation up next, right here on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.